Hello, everyone. I am Jean Sachs. I'm the CEO of Living Beyond Breast Cancer. And as many of you know, a breast cancer diagnosis, whether it's early stage or it's metastatic, means you will get care from a variety of doctors and other healthcare professionals. It may feel like no one in particular is completely on top of your treatment. And that's where a nurse navigator can come in and be incredibly helpful. So to help you understand what a nurse navigator does, I am really pleased to welcome Susie Ulloa, who works in oncology navigation and is a recipient of the ONN-CG Navigation Excellence Award, which is wonderful. Congratulations.
Thank
you.
you.
So Susie, thank you for being with us today.
Thank you for having me. I appreciate the opportunity.
Great. So let's start just with the basics and let people know, what is a nurse navigator?
Well, the goal of nurse navigators is to reduce cancer mortality and morbidity. And how that is done is by eliminating all the barriers to care, to timely and adequate care. Those barriers could be of any kind. It could be financial, psychological, social, logistical, or related to communication, a language barrier, literacy, even equity of healthcare delivery. So what nurse navigators do is we try to decrease those barriers so that patients can have the access to the care they need.
Sounds so great. It's what we all need. So what role would a nurse navigator play with the breast cancer care team?
Well, first of all, that nurse is an integral part of the team. She or he keeps communicating with all the other professionals in the team, the oncologists, whether that is radiation, medical oncology, surgical oncology, genetics, any and all of those professionals. And the benefit of that is that patients have an ongoing source of support and resources at all times, while also undergoing all different phases of treatment. As we know, breast cancer has different forms of treatment at different times. And it has been proven that patients who have a navigator have shorter periods of time between diagnosis and starting of treatment. They better comply or adhere to treatment. They have more information, not only them, but their caregivers. And so they are more empowered to make informed decisions. And they also have a better quality of life. Those navigators are going to make sure that patients have all the resources they need beyond the doctor's offices. We know that they are very well supported in that they can call the doctor or the nurse, and even after hours they can reach someone. But there are other things that kind of like sometimes fall through the cracks. Do they need nutrition? Do they need more counseling one-on-one, transportation, financial assistance? So those kinds of things are the ones that navigators make a priority. And we understand these patients on an individual basis. And in that way, we also can come up with an individualized plan so they can have the care they need.
That's really helpful. So there are so many benefits of working with a nurse navigator. And if you're not working with one and you're listening, we'll make sure we give you some information on how you can get one. But Susie, I know that breast cancer is familiar to you. So can you share a little bit about your personal experience and the benefits you might have had from having a nurse navigator on your own team?
Thank you. Yes. So I had breast cancer in 2014. And I went through all the treatment, medical oncology, surgery, radiation, and then tamoxifen. I still have a great medical team, and I have always felt very supported, and I am doing very well. So thank you for that.
Yay, that's great.
Yes, that's always great news. And so one of the things that happened is at the time that I was diagnosed, we did not have a nurse navigator on that team. And so for me, looking at that, I look at that more from the navigator's perspective and think about all the things that maybe I could have done for myself. And so that's it's difficult. But sometimes I look at my experience and knowing that being a nurse, I was able to, in many instances, advocate for myself when I needed to do that. And so, of course, hindsight is 2020. I would have liked to have that person there to help me. I would have called and say, hey, this is happening. Can you please help me? I'll give you one example. And it was one day that I had a fever. And sometimes it's difficult to get a hold of the doctor's offices. Those staff members and doctors are so busy and the volume can be high. And so I wasn't feeling that great. And it would have been great to just call the navigator and say, can you please get a hold of my nurse, my triage nurse, and let them know that I'm not feeling well. And it worked out great because it was nothing serious. And I got through and they sent me the medication. They saw me immediately. So it turned out very well, as most times that happens. But it's always good to have that advocate on your corner, that person that you can always call for at whatever time, and they'll just do their very best to help you find a solution.
Great. That's a helpful example. So just on a practical matter, will insurance cover the cost of working with a nurse navigator?
As far as I know, a lot of programs are not billing for those services. They're part of like the package of care that is given. I don't know specific cases. There are some that I have decided to pay for navigation services. So I think it's a breakdown between yes and no. Mm-hmm. Some of the facilities that are not billing for those services also provide navigation regardless of if they can bill for that or not, because the benefit is so great. So I would encourage anyone to ask if those benefits are covered. For the most part, they are. And patients will likely not get a bill, whether the cancer center can bill insurance for that or not. They're trying to provide services for patients regardless.
Great. So if you are someone who's in treatment or newly diagnosed or helping someone, how can you find a nurse navigator if your care team hasn't already referred you to one?
I would say, first and foremost, ask your team. They would know, and the doctors and nurses in those offices would know if there's a navigator that they can reach out to. So that's the first way to do it. Another way to do that will be to go online and just go online and find navigation programs, because there are, even though not everyone has navigation programs, the tendency has been to increase those opportunities for patients, and more people are joining the navigation role. And so I would either ask directly my team or find that on the internet. There are other resources like yours, like Living Beyond Breast Cancer, that are very knowledgeable. And so an internet search will be another good opportunity.
Okay, great. So are there any specific resources? Does AONN have a resource or any specific website you would suggest people go to?
I probably would suggest AONN as well, the Academy of Oncology Navigation, Oncology and Patient Navigation. They are very knowledgeable as well. And just a plain search online, navigation or nurse navigators in whatever center or whatever city, that will also be a good opportunity. AONN has a good group of navigators that have created like a chapter, if you will, in each city. Mm-hmm. And so they would also be able to likely connect someone to a navigator.
Okay, that is so helpful. Well, you absolutely laid out why a nurse navigator is a key part of your care team, and that it's not just about your medical treatment, it's about everything from your finances, your emotional health, your family. So thank you for the work you do, and for sharing this information, because we know that not everyone is aware that they can have a nurse navigator on their team.
Exactly. Mm-hmm.
So thank you for joining us today. And just want to let everyone know, if you want more information on nurse navigators, we'll have links on our website at lbbc.org. We also have peer support programs. So if you're interested in being connected with a peer group, please log on to our website to join one of our closed Facebook pages or call our helpline. And thank you, everyone, for listening.